Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation coming live. Oh, there we go. Coming live from New York City with Dr. Roy Geronemus, world-renowned laser expert. Let us know that you see us. I'm just going to check my phone here to make sure I can see us live. I don't see us yet, so let me just check, get a little, it says live, so I got to see myself and Dr. G. Where are we? We should be on here because it says live. See, it says we're live. So let me see. Okay. Boom. We are live, and it just should pop up with us. I am not seeing us, but it's okay. We're on here. Oh, yes, Crystal. Oh, Crystal says she can see us. I'm just not seeing it. Oh, there we are. Okay. Ooh. Hi, Jim. Hi, everybody. Whoa, we got a lot of people on already. So the questions will come up here, and Dr. G is on.
Yeah, is this my big chance to say live from New York?
Yes, go ahead.
Pleasure to be here.
Live from New York. It's Dr. Roy Geronemus.
There you go.
So we have a lot of people on. Hi, Crystal. Hi, Marissa. Hi, Jim. Hi, Harladur. See you, Kathy. Andrea Afton. We're here this month with Dr. G. This is his new office at 110 East 60th Street. A good hefty walk from Penn Station, but a beautiful walk up Fifth Avenue.
Yeah, half a block from the subway system.
So. Beautiful, like the subway is right out here. You've been treating since you opened the place.
That's correct.
You're still working on getting all the insurance.
But that'll be worked out soon.
Yeah, but right. You're treating babies and adults,
that's correct.
And you guys, I see you all on. Hi from the UK. Kaylee says we'll see you on Wednesday. We can take your questions, but I'm going to ask him some while we're waiting for all your questions to load. So tell us, how excited are you about the new Pro?
With the new Pro, it is a big step forward in pulse dye laser technology. It has numerous advantages compared to what we've used in the past. Most importantly, it has very reliable output. So it's a technical thing from the physician's perspective, but from the patient's perspective and the outcome, it's giving us much more consistent results in terms of what we're providing to the patient. So it has a larger spot size, so the treatments are faster, which is particularly helpful for the children. So we can go up to 15 millimeters with the spot size compared to the older pulse dye lasers, which went to 12, but it was very hard to treat at 12 millimeter spot because there wasn't much energy. This laser has 50% more energy than what it had in the past. So more energy, larger spot size, and more reliability. So when I visited Candela to see the laser about a year ago, they showed me a graph that showed the pulse-to-pulse variability, and there was very little variability, which was different than what we had seen in the past. So on a technical basis, what happens with the older pulse dye lasers is that the dye in the pulse dye laser degrades over time, and that makes the treatments a little bit less reliable. Also, there are lots of internal changes, which makes the optics and the energy output just much more consistent. And this has real consequences. And the real consequences, I think, are better outcomes, more comfortable treatments. It also uses a different approach to cooling. So where we've used the dynamic cooling, that's the spray that's used prior to each laser zap. It also delivers that spray after each laser pulse. So not only do you have a treatment that's faster, more consistent, but it's also less uncomfortable. It's a better overall experience, let's put it that way.
When you premiered it at our super clinic in October, there was a man who had not had treatment in 15 years, and he said it didn't even hurt, and you didn't even use numbing cream. So are you...
Well, I can't say that it's painless.
Not painless.
But it's less pain.
Less pain.
Less painful.
Less painful.
So this has particular benefit for the children. I mean, one of my goals over the years is to minimize procedures that are done under anesthesia, particularly for the young children. So I think number one, that carries a little bit of risk. 2, it's a much more of an ordeal, and 3, it's a lot more expensive. So, we want to minimize all of those things. There's also that FDA concern about repetitive exposure to general anesthetics under the age of 3. So if you can get a lot of these treatments done or perform more effectively and more completely before the age of 3, that makes a very big difference in terms of minimizing risks and just making an overall better experience.
And I mean, like you published on this, your weekly treatments.
Right.
And so average those, however many you've done in weekly, 20, 30 babies, they're...
No, many more than that.
Yeah, many more, okay.
Oh yeah, many more.
So they're basically at maintenance to where then they don't, like...
Well, some clear completely.
Yes,
and other ones need maintenance.
Right, but
So
but still, they're done. They're reaching their maximum point before they're 1 year old.
In many cases,
Yeah.
Some we cannot. I think a lot depends on the anatomical area, the thickness of the malformation. There are lots of variables. Some of the patients respond with extraordinary success, and others, not as well. Again, depending upon location, thickness of the malformation, and other factors as well.
So we're getting questions, and Kiana's on and Jim's on. So Kiana, if I miss any questions, copy and paste them and put them in again in case I miss them, because I'm looking on my phone and the computer is off. So Marissa Lay says, "Hi Dr. G, my daughter Claire is coming down to meet you for the first time in a few weeks. She's had 15 plus treatments already, so you put the small children under anesthesia or not?"
We try not to put them under anesthesia. I will not put a child under anesthesia under the age of 3. But by and large, most of the patients that we're able to see during the first few months of life don't need anesthesia by the time they get to 3. So that's the major advantage. If you're coming in, we haven't seen you before, please bring records or the parameters of previous treatments so that we have some basis for comparison.
See, like on there, I see that question, but it's not on here. Will this laser be used in Milan or only in New York? Right now, the Pro is only in 4 places in the U.S.
Right. The Candela Laser Company is introducing the device next month. Actually, next month, April, at the American Society for Laser Medicine and Surgery meeting. I'm not sure about their production schedule, but hopefully it becomes available nationally in the U.S. and internationally before too long.
Oh, Kathy says, so see, I am seeing questions on here and not on here. So
Okay.
people,
Okay.
she's saying, I forgot to ask this morning, how long does it take to fully heal from a laser treatment? That's Kathy Guyette Cohen. Go Bills. So she must have just seen you and was from Buffalo or something.
Right. So it depends on the parameters that are used, and some of the newborns that we treat, there's very little healing at all. I mean, there's just no bruising, so the healing's right away. But in terms of the treatments that we're providing, there generally is not scabbing. It's very rare to see that these days. There's no wounding, so the only thing we really see is bruising, and that varies depending upon how aggressive we are and the parameters that are chosen and the age of the patient.
Thank you.
One of the reasons for treating the young babies on a weekly basis is that they don't get bruising or they don't get significant bruising, allowing us to retreat very frequently.
I see another question on here. I'm writing to you from Romania, and we were just talking about that. My boy Kevin is now 2 years, 9 months. He has Sturge Weber, port wine. It's all over his face, neck. Kevin has had 16 sessions with Dr. Coletti, but the last ones have not had any results. The last time in February, he also did an ultrasound and told us the port wine on his face is about 2 millimeters deep, but that is now purple, no longer red, and there are no more results. He only recommended maintenance twice a year, or to ask you if your device from New York could help Kevin to get even better results.
Without seeing Kevin, it's hard to say. larger spot size with the newer lasers do provide the ability to treat more effectively for some of the deeper lesions. But if it's a very deep malformation, and Dr. Coletti would certainly is well qualified to make that assessment, it makes it difficult to get a dramatic response in those cases.
So Ruth said, I may have missed it, but what's the overall cost of a single treatment with this new laser without any anesthesia? I guess if insurance.
Insurance typically covers it depending upon where you are and what type of procedure is done in terms of the size of the procedure. So in general, I think in the insurance companies that we deal with in the Northeast and beyond, the procedures are typically covered by insurance.
Yeah, but I had asked Joan today too, and it does seem like you do have some cash fees for people.
Yes,
who are paying
yeah,
cash.
I mean, they can certainly contact my office.
Yeah,
get that
and find
information.
out. It's very affordable, she told me, so it is affordable. Claire would like to know, how long does laser take to do a treatment, and will they have polka dots? So are you seeing the purpura?
We do see purpura when the kids get a little bit older. With the newborns, we don't see it. Okay. As they get to a few months of age, we begin to see the bruising, the purpura. It doesn't seem to last as long.
Oh, that's interesting. The purpura clears up quicker.
With the larger spot sizes, they're not lasting as long.
That's very interesting. So,
but a lot depends on how aggressive we are.
Yeah.
And sometimes we have to increase the energy or shorten the pulse width, and that can lead to longer lasting purpura.
Okay. So Crystal says our daughter's been treated by Dr. Nelson since birth. We're on the West Coast. At about 2.5, her clearance was 90%. That's very good. And we started maintenance, but now she's turning 4, and it seems like her spots are getting darker, even though we are still maintaining treatments every 3 to 4 months. He's using the Perfecta. Will this new laser help achieve more clearance again? Is the redarkening normal?
First of all, you're in great hands with Dr. Nelson, and there's no question about that. Redarkening can occur. What we have found is the more clearing we get, the less likely we are to see redarkening. I do have some patients who have very, very long-term follow-up, over 10 years, with no redarkening, that people we've essentially cleared. But people who don't clear are more likely to get a darkening. I do believe very strongly that the new VB Pro does provide better outcomes.
Rachel says her 3-month-old has hemangiomas that are superficial. Can the PDL be done at 3 months? Would it ulcerate if we do the PDL during its growth period?
No. It may, depending upon how it's performed, and there's always that aggressive hemangioma that's going to ulcerate no matter what you do. But we do treat hemangiomas during the proliferative phase for 2 reasons. One is to slow down the rate of proliferation, and 2 is to enhance the involution. So I'm in involution meaning the disappearance. Not everybody agrees with me, but I feel very strongly for superficial hemangiomas that it's a great treatment. And even in this era of using the drugs by mouth, that it's still a very valuable treatment.
And I think a lot of our laser experts agree with you on that.
A lot of them don't.
Especially because, but there are a lot of adverse side effects from the beta blocker too, and if you can get these babies early with the early proliferating hemangiomas, you've got a better chance of putting them into involution.
Well, the beta blockers don't really work on the superficial hemangiomas anyway.
That's true.
So they're really designed for the deeper ones below the skin, or the mixed hemangiomas with their superficial and deep, or in important anatomical areas. But I think the laser treatment is underutilized for hemangiomas in the growth phase in this era.
I agree. Ashley says she has a port wine stain on her nose and forehead. She's 54 years old, female. Are there treatments surface only? Can I be treated if the veins are running into my brain? So it sounds like she may have a CM AVM.
Well, it sounds like you need further evaluation. If you know that the veins are running deeper into the brain, then there's something much more complicated going on there, and laser treatment only helped the color It won't help the underlying problem.
Okay, thank you. This is an interesting question. Tina says, why does her skin get darker in week 2 post-treatment?
That is an interesting question. That doesn't happen with everybody. But, we do see that periodically. The vasculature can expand and contract, and there may be temperature changes as well. And then also may be a little bit of bruising, or depending upon your skin color, there could be something called post-inflammatory hyperpigmentation. And I'd be curious to know if your skin's a little bit darker. We see that more commonly in patients with darker skin.
Understood. She'll probably write back. From Crystal, hello, our daughter has been treated by Dr. Nelson. Oh yeah, I already got that one, thank you. Does the new laser have any better clearance on the hands areas or other areas of the body further from the heart?
I think there generally is more clearance everywhere, but the ability to use a larger spot at higher energies and deliver the energy more consistently. But with that said, anything below the elbow, anything below the knee is very challenging and very hard to get clearing.
But if you get the newborns,
Newborns, we get a better response, but it's still, in those areas, hard to get complete.
Right, it's not perfect, but it's better if you get them in
It's definitely
earlier.
better if we can get them early.
Bernadette wants to know, will the new laser be available in Australia?
I can't speak for the company, but I'm sure they want to sell it everywhere. They're a great company, and they want to, make it available as widely as possible.
Yep.
I'm sure.
I'm sure it will be there. Debbie wants to know, shouldn't doctors be using ocular shields when having laser around the eye?
Well, it depends where around the eye it is. If we're treating what we call within the orbital rim, that's above the area that you could feel with the bone here and the bone above the eye, then the ocular shields are very helpful and very important. But many times, if it's beyond that, just in here, or even right below the brow, you can use adequate eye protection and be fine without a shield.
Hello from Romania. How long does it take to have the new laser in Europe? Another person wants to know. Well, that's for Candela.
I can't answer that question.
Right. Adrian says, I have an 8-year-old with a facial port wine. He's had 30 treatments. The plastic surgeons here are not adjusting the settings, and one has left a scar twice. Is it possible to still see clearance at his age? He's 8. And with this many treatments already, is it possible to flatten out the scarred area?
The answer is yes to both. You can improve the scar. There are different treatments for what we call atrophic or depressed scars. It might be a different type of laser that could be used for that purpose. So that can be very, very helpful. But I think at some point, after 30 treatments, one has to take a look at the technology and the technique to see if something different can be offered.
Technology, technique, settings, the whole thing.
Right, exactly.
Right. And we have a conference, everybody. It's in October in New York City with Dr. G, with the pro, birthmark.org. We likely will be closing registrations once we reach our maximum capacity, which we have been. Granted, it's in October. We opened registration in March, and we already have quite a few people signed up. So please don't wait if you want to come. From Ruth, I may have missed it. Oh no, sure, we already got that one. Her daughter was 5 months. She's white as snow, her skin color.
Good, we like that. Yeah,
you asked if she had dark pigment because she was seeing it darker.
Right.
And she sees Friedman, but she said that she noticed day 10 it gets redder before it gets lighter. And I know too, a lot have this eczema thing that makes it look darker.
Yes, we see that quite a bit, and it's often misdiagnosed.
Yeah.
Port wine birthmarks by themselves have a tendency to develop a little dermatitis or eczema. That's rough, scaly areas. But we've also noticed that people getting multiple treatments will see a greater incidence or a greater number of them will get this eczema that will require some steroid cream just to settle things down.
We actually have a study going on about this right now. Dr. Cohen, myself, and a couple medical students.
Well, I published that in about 30 years ago.
Oh, what was your conclusion? Just
we had an incidence was like 3 or 4%.
Yeah.
And it was there, and it's just something that we saw more commonly in people undergoing repetitive treatment sessions.
Because my hypothesis was that the statistical probability of having eczema, which is pretty high in children, and the port wine, that it kind of converges.
100% true.
Yeah.
So it's not uncommon. For example, I just got an email from somebody in London where I was concerned they had a little bit of a rash. I wanted to see the normal skin on the other side of the face, just to make sure there wasn't that propensity towards eczema. But that's something that one has to consider. But I think you're right, Linda.
Just like a overlap, 20%.
Pretty good for a non-physician.
Pretty good for a PhD. So Anne says, Kleinman-Zeller, any suggestions with the lip area being so large, an increased lip? I recently had the Candela laser done with great results, but not sure if it's doing anything for my lip. Is the only option reconstructive surgery?
So the laser does not work on the thickness of the lip. By and large, if it's what we call subcutaneous or thickening below the skin. We've been working on a newer technique that helps some of the thickness of the skin that you see in the more mature birthmarks, not the kids per se, but maybe it will at some point, where we're using a newer laser in combination with the pulse dye laser, or even the 532 nanometer
The
YAG laser, KTP, that's made by Lutronic, which is also another good device. And this combination technique, where we're using a device made by a company called Aveva, the laser is called Myria, in combination with the pulse dye laser, is helping some of that thickening. I think I showed you the photograph of that patient that you met in my office recently, Linda, where he had dramatic reduction of some of the thickening of the skin that occurs on the upper lip.
It's amazing. Allison was your patient recently, Mallouk, M-A-L-L-O-U-K.
Right.
So she wants to know, did you use the Pro on me? Because whatever you used on her was a game changer.
So what I used, if you don't mind my saying, Allison, an old friend of mine, well, you're not old, but a longtime friend of mine, I should say.
She's only 43. She even put it in there. I'm jealous.
Okay.
I know,
Well,
I'm
she's
jealous.
got a good sense of humor, so she'll appreciate it. What I did for Allison was this combination technique I just talked about.
Oh, you used a Myria
So
on her?
I've been using that in the adults with resistant port wine stains, and I'm starting to see some really interesting results. I'm very excited about it. It's a technique, it's a technology that was developed by Rox Anderson and Dieter Manstein. And Dieter and I have been working on this for vascular lesions, and we have some biopsies and some interesting results to suggest that this is another way to treat vascular lesions, blood vessels. So for patients like Allison, I've been using this combination technique, and I'm really glad to hear, Allison's feedback that it's a game changer, because I saw a patient today who had been resistant, for many years. It's a teenage girl, and she had a lot more clearing with this newer combined technique.
So, Allison, if you don't mind, my email is posted in here, vbfpresident@gmail.com. I'd love to see a before picture and then one when your purpura clears up, so we can let people know that Dr. G has got this new combo for previously thick and resistant ones.
Thickened ones and also resistant ones.
Thick and resistant,
Now, keep in mind, for parents out there, I've not yet done this on children. I think ultimately we're going to have to, because it's really interesting, and I think it's another advance.
Will either you or Dieter be presenting at the ASLMS?
Dieter will be presenting this in the cutting edge session at the ASLMS, and he'll be presenting some of my patients and his scientific work.
That's awesome.
Dieter's made this observation and showed me an image, so I took off with the idea that he developed, and making it work clinically.
I really am so excited for these families that, you're just giving, and it's all happening at once, isn't it?
Well,
it's a real time of change.
I think that's important, because I think the field had stagnated. So a number of things have happened. So now we're looking at larger spot sizes, we're looking at more energy, we're looking at more consistent delivery, we're
Going
looking
deeper.
at going deeper, a better cooling mechanism, and
More
now
comfort.
we're looking at an opportunity to combine therapies to get even a better outcome.
So Ashley was the one that has brain involvement, and she wanted to know, should I see a vascular neurologist? You can also email me at vvfspresident@gmail.com so I can get you to the right person to assess. Is it Serge Weber or is it intracranial AVM or whatever it is? We want you to go to the right doctor. So you can just email me and I'll find somebody down south for you. Okay, so Marissa says Claire's been treated by Dr. O since she was a few months old. She didn't like to treat in the summer. Do you agree?
I do not agree. We treat year round. There's some, we don't like treating people who are overly tan, but you can make adjustments, and we do encourage sunscreens, which you should be using anyway. So, no, I don't think you have to hold off on treatment during the summertime. But I do think it's important if you're coming in for treatment that you not have a deep tan.
We tell people that all the time. That's
Right.
not, doesn't work well. So Pat says, could you recommend a doctor in the Boston area for an evaluation of a port wine stain on my grandson's arm?
I think we could do it offline.
Yeah.
I'll have them contact you, Linda.
Yeah,
Okay.
yeah.
And
I
there are
mean,
lots of great physicians in Boston.
yep, absolutely, yes. So, and you can go to our website at birthmark.org, and up at the top it says find a doctor. Zachariah says, I appreciate your efforts that you're doing on birthmarks. Alexandra, my son is 6 years old, had 4 lasers, also with Dr. Coletti. He's very scared. He doesn't want any more. Is the new laser more painless?
The new laser is less painful. The cooling that occurs both before and after each laser pulse makes it a more comfortable procedure. With the larger beam that we're using, it's also a faster treatment. So by and large, it's a better experience, but I wouldn't call it painless.
Right, but I guess like I asked an adult who had had the treatment before, and he said he thought it was like around a 6 on the pain scale. And when I asked him with the pro, he said at least 50% less. So that's
pretty consistent.
That's a good. That's about what you're hearing, that it's like 50% less. So someone wants to know about treating a port wine stain on the lips. Now, if it's not enlarged and it still has stain on it, but it's not hugely overgrown, do you treat the lip?
I do treat the lip. I think what's happened is that, results have gotten good, very good, very good. So, we're getting so much lightening of the normal skin. You don't want a patient walking around with red lips. So, we do treat it. You can't always cure it completely, but it does minimize the contrast that one sees. This is also true, something that we're seeing with the eyebrows. We've got patients now have such dramatic clearing on their faces, and we haven't been treating the eyebrows because you can lose some hair. So their faces look great, but they're walking around with these red eyebrows. So we're more recently been treating them at lower energies. It doesn't do quite as well, but it does minimize the contrast, so you don't see the deep red.
So you're getting a little bit more. Maybe you just do repeated low energy ones.
And that's what we're doing.
Yeah.
We have to be very, very careful because we don't want to have prolonged hair loss.
Right. Jenny says, any suggestions for bilateral port wine on the chest, the back, the arms, and the hands? Would you recommend doing treatment in one sitting? We tried with you when he was a baby, but he's 7 now, and I don't know how much he can handle in one setting.
Well, as a 7-year-old, that's probably a lot to do. We do like to use a topical anesthetic, but that might be too large an area. We do have to limit the amount of topical anesthetic we put on the skin. It's unsafe to put it over too large an area, so it's a calculation that we do based upon body weight as to how much we can actually apply. But it's probably best to break it up over more than one treatment over such a large area.
This is a good question. Valerie said, What are the hesitations or concerns with this combo approach that you're using that's getting through, that you're not using it on children? But you didn't say you weren't, but...
Well, I haven't yet.
Right.
So typically
Right.
when something new comes out, we start with adults and we work our way down to just to show that we're safe. It's also, you're now introducing a second laser, so it's a longer treatment, and, it just makes it not as simple as it was, with a single device.
I
think ultimately we'll get there. It's just, the Hippocratic Oath is first do no harm.
Mm.
So, we want to make sure that we're doing something safe.
Exactly. This woman wants to know if you will be coming to Milan with the VBF team anytime soon.
Well, I love Milan, but not anytime soon.
Dr. Nelson's coming this year for the first time.
Good.
So maybe we can get you next year to come to one.
Yeah.
Valerie wants to know, is there any laser for a young male who had to have open heart surgery and now has a Leond, I don't know what that is. He had open heart surgery and has something. He must have a port wine stain. Is that counter-indicated? I don't.
Contraindicated? No, it shouldn't be a problem.
Surgery. Okay, I'm not sure. So Miriam says, "Hi, Dr. G. I'm 65. Oh my gosh, she had the argon laser.
Okay.
It did cause some hypopigmentation and scarring.
Which
Not
is
noticeable.
not uncommon back then.
I'm wondering if the argon possibly caused scarred tissue below the skin and maybe making my port wine on the right cheek more resistant with the pulse dye. I saw Dr. Utan for years. I now see Dr. Sal. She used to be a part of our team at the MGH.
Mm-hmm.
I originally saw Dr. Russo Lilo in Connecticut. Will the new laser help break through this resistance, and is it more effective with a bleb than the pulse dye laser?"
So,
it sounds like she's got some overgrowth.
you raise a number of points here that are very interesting and valid. First of all, the argon laser did cause some hypopigmentation. Yes, there was scarring below the skin. That does make the penetration of the newer lasers more challenging. But with that said, we use these same lasers to treat scarring. And so I think there could be benefit in continuing treatment with a pulse dye laser to see if one can improve both the color and the texture of the skin. There are also some newer options for treating the loss of pigmentation. In that case, we're using some ablative and non-ablative fractional lasers in combination with some topical solutions that can help return some of the normal pigmentation of the skin. So I think there are multiple new opportunities for a patient like yourself to address your concerns.
What this woman was saying that I didn't know was her son that has this port wine had open heart surgery and has a large keloid scar down his chest from the open heart surgery.
Right.
Can the laser fix that?
Laser can be helpful for what we call hypertrophic scars that are mildly thick. But once it's really thick and goes above and below the skin and is so true keloid, then the lasers don't do much. But if it's a hypertrophic scar, the laser should be quite helpful. And the term keloid is often overused, so it's hard to say, but there's clinical judgment as to what's a hypertrophic scar and what's a keloid. But it is important because it does impact the choice of whether or not to intervene with treatment.
This is a good question. So Rachel says her child has 2 hemangiomas and she's planning to get the PDL done. Should she check for internal hemangiomas? What do they do? How do they detect them?
The only time we check for internal hemangiomas is when they have more than 5.
Right.
So without that, I don't think it's worth an evaluation.
No, not 2.
With just 2, no, I wouldn't go down that path.
Zachariah says, my port wine covers 1/3 of my mustache. I'm now 23. I've never been on treatment before. Is the laser treatment going to cause hair loss?
That's a very rare side effect or complication of the treatment. I've only seen it once or twice.
In the mustache area?
Right. I just generally don't see it. I can't say it won't happen, but at the age of 23, when the hair is more coarse, we're less likely to see it. I'm more worried about it when the hair is finer and the hair follicles are not as mature.
Okay, Afton wants to know, what age do you generally start a topical anesthetic?
I usually wait till a year of age. There's some debate about this in the community, but I think one of the concerns with topical anesthesia, there can be absorption in the body. So the little babies are so small, it doesn't take much to get absorption. And back in the early days of the EMLA cream, when it was first introduced, there were problems. So I do respect that, and I'm very cautious as to when to begin and how much to apply.
You don't use any general anesthesia, right?
I don't. I do IV sedation in some of the older patients.
Mm-hmm.
So that is something that we do offer.
But no longer, you don't do hospital?
I don't do hospitals. I refer to other physicians for that.
Okay.
Yeah.
Adrian says, with my 8-year-old, how often would be ideal to have treatments to achieve clearance if we travel to New York to try a treatment without GA? Any advice on keeping an 8-year-old calm during a treatment on his face? I'm concerned we'll travel there and he'll refuse it. Well, come to the free conference.
Well, I mean, that's always a concern. I think some counseling is always helpful. Sometimes we will use the topical anesthetic. It a lot depends how big an area it's being treated. At that age, we can also introduce laughing gas, nitrous oxide, in combination with oxygen. And that's something that can just take the edge off these kids.
I can say too, like at our clinic in October, we treated 40 kids and 60 adults, and none of the kids refused. I mean, they all seemed fine.
Yeah,
once they get there and get around other kids.
But I recommend as a parent, a lot of talking, a lot of discussion, a lot of preparation as to, why you're doing this and how it's going to be done, so, it's not a sneak attack on the child.
Well, that's a good question I didn't see on mine. Does the port wine on the scalp thicken over time like on the face?
It can, and sometimes we see these nodules or even pyogenic granulomas, these growths that occur within the vascular birthmark. And, our approach has been just to deal with the thickening when they occur rather than treating into the scalp to avoid the hair loss.
Okay, this is another question that you've already answered, but do the new lasers work better on the extremities?
They do, to some degree, but it's still hard to clear anything below the elbow and below the knee.
Oh, Taylor has a great question. Hi, Taylor. Always look forward to hearing from you. She wants to know what your thoughts are on the PDL and IPL on a port wine stain that's resistant and also eczema prone.
Okay, so the IPLs can be helpful. It requires real knowledge of how to use the IPL. There are some very, very good IPLs out there, like the BBL is a great device, and there are publications and physicians who have experience in that area who are able to get significant lightening. I haven't done much in that area, so it's hard for me to comment, but there are believers out there who are using them properly and effectively.
Nutla says, hello from Ireland. I'm 49 and I've had treatment since I was 18 on and off. Every clinic tells me their laser has been really successful removing it, but I have had very little fading. In all honesty, am I kidding myself continuing with treatment, hoping for some clearance?
Well, I think the answer to that is, how were you treated? Which device was used? What parameters were used with that device? Where is your birthmark located? So I think with the newer technology, it's worth reevaluating people who've been resistant or failed to respond in the past.
And check out our website at birthmark.org to find out where the free laser clinics are. We have 3 of them this year. We have in May with Dr. Pooja Soja in DC, and she has the V-beam, the old V-beam.
Right.
And she does have the Derma V as well, and she's been using it. She likes it. We have
And just for completeness, the Derma-V also uses the larger spot size. Also has a very fast repetition rate, so you can treat more quickly, and also uses the post cooling. So that's another consideration for those who don't have the newer V-beam right now.
okay. If do you feel it's necessary to use anesthesia? Okay, do you treat in office or in a hospital? You already answered that. You answered that. Any advice for Sturge-Weber port wine patient, please? A lot of them want to know if they get the laser, is it going to bother their seizure issues?
It typically does not. We treat many, many, many Sturge-Weber patients. It's not a reason to not treat. So I think they should be treated like anybody else, including the eyelids. And again, having an eye shield placed is something that can be done in the office setting. And I wish more physicians would learn to do it. It's not particularly difficult. There seems to be some hesitancy in the medical community by putting eye shields into these kids and some of the older patients, but it is doable.
Chelsea said, my daughter had treatments done on her brow as an infant, but not since. Do you think it'll affect her hair?
How depends on the age of the daughter now. As the kids get older, particularly post-puberty, the hair is thicker and can tolerate the lasers better. But even for the younger kids, the treatments can be done not as effectively, but at least in an effort to minimize the darkening of the skin color.
This is a long one, but Olivia, she wants to know, her son Preston has an infantile hemangioma. It's in the cheek. He's now 15 and has some red and a little fatty tissue left over from it. Do you think they're in from Alabama, could this combination approach that you're doing? I'm thinking it might.
It might. And, if it's not that combination approach, certainly the redness can be treated. If they're individual vessels, then I'll use a YAG or a KTP laser. If it's overall redness, then I could use the pulse dye laser or the KTP as well. If there's some thickening of the skin, sometimes we'll do what we call a resurfacing procedure. That can be helpful for that.
And Olivia, bring them to the super clinic in October. The lasers are all here. Allison says, I have VNS. It's a vagus nerve that gets close to your heart, but it's well worth the surgery. Oh, I have had seizures since 3 months old. Okay, she's talking about her Sturge-Weber. Okay, we have quite a few on. Okay, so it looks like I'm caught up, thank God. That was quite a flurry. We still have 15 minutes left. People are sending me messages right from. You have to put the messages in the chat. Okay, you can't just text me. You have to put the messages for Dr. Geronemus in the chat. If I've missed any questions, resend them. Again, for October at the Super Clinic here at 110 East 60th Street on Saturday, October 11th is going to be the consultation and the laser clinic day with the bedazzling and the book reading and the psychotherapy. That's Saturday. Friday, we have the talks at NYU, the ultrasound clinic, and Sturge-Weber and dental. So check out our website at birthmark.org to find out when all these exciting things are going to be happening. And yes, Dr. G will have the pro. Hi, Dr. G. My daughter is 18 months and has had 12 treatments so far. We have not used numbing cream. Would you recommend it now? She has the port wine on her cheek, her eyelid, her eyebrow, and lip. Do you use an eye shield? Yes, of course. You're the king of eye shields. We have traveled to New York City since she was 3 weeks old, and I want the best laser available if we are traveling from Arkansas.
So we can use some topical anesthetic at the age of 18 months. One of the problems with these kids is that they often wipe it off. So it's just not as effective as it would be in somebody older. But it can be done for at least a portion of the area. As I mentioned earlier, we do have to be mindful of how large an area we're applying the cream to avoid administering too much so there's no absorption into the body to make the child sick. So it's an important consideration, but yes, the topical cream can be used.
Good question. Afton wants to bring her son to the clinic, but she's hoping he'll be in maintenance by then. Should she still sign up? Yes, because you don't know. Like, you're hoping for maintenance, but it could come back, and then you don't have the appointment, and we get closed out. So make your reservation, and then if you want, you can cancel it beforehand if you decide you don't want to come. But you got to register in order to get it. You got to get in it to win it, just like the lottery says. Hello from Norway. Hello, Dr. G. What settings would you use on a V-beam perfecta for a superficial port wine stain V3 bilateral?
Well, that's a good question. A lot depends on the pigmentation of the patient.
Norway, probably.
Probably fair skin coming from Norway, although they do have immigrants there.
Yes.
And how old is this patient?
Just says, would you V-beam for just doesn't say. She doesn't say the name.
So
the age.
a lot depends on the age of the patient.
Yes.
So, under the age of 4 to 6 months, I probably would use a 1.5 millisecond pulse width. That's the amount of time lasers administered to the skin. As they get older, I shorten the pulse width to 0.45 milliseconds, and I like to use as large a spot size as possible. Now, a lot depends on the quality of the device, what kind of shape the device is in, whether they can sustain the higher energies of the 12 millimeter spot. If the device is running well, then I would use a 12 millimeter. Otherwise, I would stick with a 10 millimeter spot.
Okay. Heraldor says, from what age do you use laughing gas? Traveling from Iceland with my son in a few days, and very nervous about him not wanting to go through with the treatment because of past experience. He is 5.
That's about the age where I would consider using it. I think we have to take a look at the child, and it's something that we could possibly do.
Okay. How much does it cost for a laser procedure? Dr. G said you can contact his office directly. They have price plans if the insurance doesn't kick in, correct? So, right, and they can tell them better how much it would be.
That's correct.
But it's very affordable. I heard the numbers, big extensive ones were 1,000 and others are 750 and some are 1,200. So, Natalie says my port wine is over half my forehead and one eye. How do I know if I've had an effective treatment in terms of bruising?
Well, it depends on the age. I assume if you're writing this about yourself, you're at a point where bruising is desirable. Not always obtainable, depending upon the spot size and the pulse width, so there are lots of parameters. But typically, that would be my approach would be to try to create some bruising with the older patients.
Well, this is a good question from Diane. For a superficial hemangioma on the face of a 1-year-old, if laser treatment is done after the growth phase, around age 2, will the results be the same if it's done now or at age 2? Will it be the same?
It should be the same. We again treat during the growth phase as well, but once the growth phase is stopped, is over, it doesn't matter whether you treat it a year or 10 years. Although at 10 years, much of it may be gone on its own anyway.
True.
The advantage of treating it at the age of 1 or 2 is that you're going to save the child quite a few years. It's going to look much, much better, especially as these kids get to school age. One of our goals in treating these kids is that, we don't want them to enter school age and have something that's going to be the source of concern to them or make them the subject of any comments.
Bullying.
Or ridicule.
Yeah, and bullying.
Bullying happens.
Yep.
It's unfortunate, and we hear it from parents as well, where they get tired of questions being asked.
Yeah.
And they don't want their child singled out.
Marissa wants to know how close, that was a good question, how close together do you like to do the treatments?
Well, it depends on the age of the patient. With the newborns, I treat weekly. This is a paper, we had published a paper earlier this year in one of the major dermatology journals showing very, very nice outcomes with the babies at a year of age, when they're newborns. As they get older, we begin to lengthen the intervals as they begin to get bruising with the treatment. So the early intervention with the babies, the newborns, is more frequent because they don't get the bruising, and it allows us to treat more effectively without worrying about the healing process.
Okay. Priscilla, and for everyone, we made the $100 registration fee a reserve fee to reserve your spot for our hotels, clinics, and everything, because people were just not showing up, and other people were on the waiting list with newborn babies, and we had to lock them out, and then people just didn't show up. So that's why we had to do the
I must say, and you're not asking me to do this, but the clinic is an incredible opportunity to get multiple opinions, to meet with people who are specializing in this field, and I think it's quite unique. You're bringing world experts together who are volunteering their time. They're not charging anything, and they're providing expertise across the board. You're getting dermatologists, pediatricians.
We've calculated it's almost
neurologists.
like $3,000 worth of free services. You get an ultrasound, a Sturge Weber, a laser, a dental, psychotherapy. You add those all up.
It's the Vascular Birthmark Foundation provides a service that is unparalleled. I mean, there's nothing like it anywhere.
Thank you, Dr.
And I'm not saying that because Linda's sitting to my right. I do believe it. And I think it's extraordinary to have these opportunities where we can share information like this and educate people.
Thank you. Douglas Rubin just wants you to know he has so much clearing on his birthmark from your last treatment, Doug.
Good. Doug also had that combined approach.
And send me pictures, because I talked to him that I wanted to see it, because
Doug's
he's
been around the block for a while, so for him to say that, and he's a straight shooter.
No, and he posted about it, and I said, I want to see your pictures, Doug, so we've been talking.
Doug, come back so we can do more of this. Okay.
Yeah, come back, Doug. Jen says, my daughter went under general anesthesia when she was younger. She's now 13 and wanting to start treatment. Do you still recommend general anesthesia at that age? Hers covers her whole right arm, chest, and back.
I think it can be done without general anesthesia. Of course, I don't know your daughter, so, it's hard to say, but I would say 99% of the patients that we treat at this age could be done in the office setting with topical anesthesia. If need be, and your daughter weighs over 100 pounds, then intravenous sedation could be done in an office setting, but there's an ambulatory facility.
Priscilla asked a question. I'm familiar with this. V-Joyce and Alpelisep for birthmarks. There's some studies going on with this drug being used in combinations, but it's really mostly for people that have overgrowth with a stain on it, because it's the overgrowth drug.
Yeah, I mean, these
chemotherapy type agents.
Well, it's not really chemotherapy. But they're biologics.
Yeah, biologics.
And the biologics, don't have a lot of toxicity side effects, and I think it's really interesting. We need to learn more about it. Particularly interested myself to see what can be done. And I think for certain types of variants of these vascular malformations, it has the potential to be very helpful.
Well, this Alexa is in her 30s, and doctors told her. She's surprised, she said, because doctors told her she shouldn't have treatment, and now that she's older, she shouldn't have treatment. So she's like saying, wow, I'm hearing now, I'm 30, that I can get treatment, and she can get great clearance, right?
Well, in most cases, unless it's a complex malformation, there is the potential for a response. So don't give up.
Yep, don't give up.
30. I have a 90-year-old who came in last week for treatment.
Yeah, another one said it's the deal of a lifetime coming to our clinics. Thank you.
It really is.
Why does the bruising in an infant vary from treatment to treatment when the laser settings are the same? That's a good question.
That may depend upon the age of the infant. particularly for newborns. There's lots of variability. It also may vary with the laser. I mean, one of the things we talked about early on in this session was the fact that the older lasers are much more variable in terms of the energy that they deliver, especially as either the device or the dye within the device degrades over time. So there may be technical reasons for that, but there also may be some just age-related considerations there as well.
So, final question, because I want you to answer this, because it'll have a couple parts, is you have different laser devices and you use them on different people. What is the post-op care? Does it vary from laser to laser? What do you tell children and adults?
Generally, I don't recommend any post-op care unless there's crusting or scabbing. Keep in mind that the injury to the skin is below the skin. It's into the blood vessel. There's nothing topical that's going to impact that.
Right, so there's no point.
There's no point.
Some people just lather it with Aquaphor, though.
I don't see the point. I don't.
Okay.
If you have crusting or scabbing, which with the newer lasers is less likely to happen, then yes, I think Aquaphor healing ointment should be used. Without that, make it simple and do nothing, except wear sunscreen.
Sunscreen. Oh yeah, that's the final word as we are approaching.
Right.
But sunscreen all year on a port wine. And
I'm a dermatologist who treated skin cancer for 40 years.
Yeah.
You should use sunscreen regardless.
And especially when they have a laser treatment, they definitely need to keep that sunscreen on.
Yeah, I think it minimizes, especially for patients with darker skin, the browning that can occur, what we call post-inflammatory hyperpigmentation. So it's a good idea.
All right, Dr. G. Well, thank you. This was very informative.
It's been a pleasure. We've got a lot of good questions out there.
A lot of good questions. Yeah. A lot of people were on. They come in. They cycled in and out. So it was a couple hundred that came in and out during the whole session. It's always very busy with you. Wear your sunscreen. Yes, thank you. Wear your sunscreen. So stay well, stay healthy, and everybody will see you in October, right?
Sounds awesome.
Thank you.
Thanks, Linda.